Do you want to elevate your needs assessments and stand out to clients? Start here with root cause analysis. Root cause analysis is a shift in how we think about clinical gaps. When you go beyond what's missing to uncover why the gap exists in the first place, everything about your CME content becomes more strategic. Here's why root cause analysis is a must-have competency for CME writers. It positions you as a strategic collaborator. Root cause analysis helps you become a thinker, not just a doer. You're someone who creates value with your clients. It improves educational impact. When you uncover what's really creating the gap, you can shape content that truly shifts clinical behavior and attitude. And it sets you apart. Many writers can summarize, but fewer can analyze. And root cause analysis makes your insights indispensable. It empowers your voice. Vague rationales like lack of awareness don't cut it. Root cause analysis gives you the tools to ask better questions and push for clarity. And it aligns with supporter expectations. Supporters don't just want to see the need, they want to actually understand it. And root cause analysis lets you demonstrate exactly how you arrived at that understanding. The bottom line here is that root cause analysis gives you more than a method. It gives you credibility, confidence, and the ability to deliver CME content that actually works. If you're ready to sharpen your skills and stand out in CME, message me.